Good morning, friends from the media. Welcome to the 11 a.m. press briefing. Present today, we have the Chief Executive as well as the Secretary for Food and Health and Controller of the Center for Health Protection. Chief Executive and the Controller will have some opening addresses before we open the floor to questions. Because of the epidemic, please put your mask on and observe social distancing measures. The Chief Executive. Good morning, everyone. This morning, together with the Secretary for Food and Health and the Controller for the Center for Health Protection here to give an account of our latest measure on containing epidemic and also our support for elderly confirmed patients. Now, you have been asking for these figures. This is about the application of RAT in Hong Kong, and also the number of confirmed cases through RAT. In the past 2 years, we have always stressed the PCR test is the golden standard for its high accuracy and sensitivity. But the downside is it takes dedicated personnel to take samples and to be sent to laboratories for analysis. So we have to wait a while before the results are available. So when we have a lot of cases to be tested, then there was a backlog. Members of the public had to wait for a few days before they could know whether they tested positive or negative. But with technological advancement and the approving authorities have also approved RAT kits. So we have started to use RAT, rapid antigen test, and PCR is the test for nucleic acid, because I will be mentioning the terms time and again. So just want to make it more friendly. Now, RAT is rapid. All of you have self-administered RAT for yourselves, and it can be used as a supplementary tool. It cannot replace PCR, which is of a very high sensitivity. PCR is still being used today, but because of the reality, we have to find out as early as possible the state of the epidemic in Hong Kong. So we have revised our view on the use of RAT, hoping that we can enhance our capacity to detect cases earlier. The advantage is when a person knows that he is positive, then he can isolate himself and take measures to protect his family members and to protect the community. And the health authorities can intervene earlier to provide early isolation and treatment. We have an abundant supply of RAT kits in Hong Kong, and prices have dropped substantially. Last year, when we purchased RAT ourselves, it cost more than $100 for a package. But now you can get a pack at just over $10. And with the full support of the central authorities, the Hong Kong South government has procured a large amount of RAT kits being distributed to the people of Hong Kong through various channels. RAT kits distributed through our infantry directly or indirectly distributed to the community now number over 8 million packs or kits. Now HAD is now distributing RAT kits to cleansing workers, security guards, and to buildings with high viral load under our sewage surveillance program. Now, the Department of Health has undertaken the following measures. On the 25th of February, it was announced that the SL government will directly accept RAT positive result as a confirmed case. There is no need to take another sample for PCR verification. And then the second measure was also announced on the same day. The CHP will set up and launch an online system as a notification system, declaration system for individuals tested positive for COVID-19 using RAT for people to report directly. It was launched formally on the 7th of March. Of course, on the day of its launch, people just tested positive could report the results. So the 6th and the 7th, they could report immediately. It also offered an opportunity for cases tested positive through RAT before the launch of the scheme. That covered the period between the 26th of February and the 3rd of March, because, as I said, we announced on the 25th of February that we accept an RAT positive result as a confirmed case. So for members of the public who tested positive during the 26th of February to the 5th of March, they could declare through the system. The deadline for retrospective reporting was the 14th of March to allow the health authorities to have a better grasp of the epidemic. And then those infected during the period might have already recovered. They might had no symptoms or very mild symptoms or with mild discomfort. After the period, they would be no longer sick, and if the symptoms were serious, it would have been hospitalized. But we would like to confirm the status of a confirmed case. That is to confirm that a person was infected with COVID-19.
We have not announced cases reported during this period since it would not be meaningful to issue an update every day. As of Monday, we have compiled the number of reports so far, and those who made reports would indicate when they tested positive, and as such we could compile the overall figures. Between February the 26th to March the 5th, for those who declared positive RT results, the number was 184,390, and this is the distribution of the dates of declaration. The green bars denote those who tested positive through PCR tests, and the orange bars denote those who tested positive through RAT. You can see that the overall trend for COVID-19 in Hong Kong remained largely unchanged. From the chart, we saw that the pandemic peaked on March the 3rd. So that was the case whether or not we include the RAT positive cases. And we have seen a downward trend in the number of cases. In the last few days, starting March the 11th, we saw a plateau in the number of cases, and we did not see a declining trend. That is why now is a critical juncture. Our work is based on science. From the number of positive cases, we can identify the current situation, but we want to be forward-looking as well. And that is why we engage in different areas of work in the meantime. And one example is sewage testing. Sewage testing started in October 2020, and since then we have constantly carried out sewage testing, and our work never stopped, even when we saw no new local cases. The work is conducted jointly between the EPD, Drainage Services Department, and a cross-disciplinary team at the University of Hong Kong. I visited the HKU laboratories twice to find out about their work. Since the fifth wave of the pandemic started, sewage testing has been reinforced. We introduced many extra fixed sewage testing spots, and that is why that means we would take samples at these spots on a regular basis. And we also introduce new ad hoc testing sites. If we saw high viral levels at fixed testing points, we would try to identify the buildings that give rise to these high viral levels. And if we look at the average figures, we saw a declining trend. The trend peaked earlier on February the 28th. There is a 4-day difference between the trends of sewage testing and the number of positive cases. That means we can identify the trend a few days earlier. In the last few days, we have experienced a plateau denoted by the red circle. That is why we must not let our guards down during this time. This chart denotes the number of cases detected through restriction testing declarations under CAP 599J. The Secretary for Food and Health would issue RTDs at restricted areas, and all individuals within the restricted areas are subject to mandatory PCR tests. We have carried out many such operations since the fifth wave started. Since January, 226 RTD operations were completed, and 154 were completed after February the 1st. And the number of preliminary positive cases detected through each operation was substantial, and in recent operations we have managed to identify 800 to 900 or more than 1,000 cases after each operation. So the numbers have remained high in recent days. The orange line denote the ratio of preliminary positive cases compared with the population being tested. For residents that are in breach of the RTD orders, they would be subject to a fine of $10,000. But so far, most residents subject to RTDs were cooperative, and they supported our testing work. And I have visited a number of sites, and I saw that our staff were working very hard, and our testing contractors have worked very hard as well. And that way the residents would know whether they have tested positive or negative. And at the end of the operation, those who tested negative can leave upon producing an SMS. Those who tested positive would be sent to community quarantine centers. for residents who tested positive after December the 31st, they would no longer have to be tested. Since they had tested positive earlier, there was no need to test them again. And even if they tested positive again, they would be considered repositive cases, and there's no need to isolate or treat them. Every day, we conduct a large number of PCR tests of mandatory or voluntary basis. They are being conducted at community testing centers and mobile specimen stations. Given the prevalent use of PCR tests, while the number of tests conducted in the last 2 weeks have been in decline, but in the last 1 or 2 weeks, the daily number of tests remain at some 150 to 200,000. So the number of positive cases went down, and it peaked in early March, and we are entering a plateau, and that means we are not going to see an obvious decline. It shows there are still a lot of silent carriers in the community.
The following two charts are more academic in nature from the Hong Kong U team, released to the public on a regular basis. Now, people like to ask the immediate effective reproduction rate, and that is how many persons can one confirmed case pass on the virus. But then that hinges upon a lot of factors, whether there are social distancing measures, travel restriction, and whether masks are being worn. Now, according to the latest figure, it is now below 1, but still we have to remain vigilant. And the last is from the Hong Kong U again. They on a regular basis monitor the commuting or journeys are made by members of the public. The more journeys made by members of the public, the higher the risk, and therefore that's why we have so many social distancing measures, including class suspension and work from home. Well, the figure dropped recently because of class suspension, and in this week there is slight sign of increase. I think the media have captured a lot of photos showing that people are now moving around in the community again. So we must not lower our guards. If people flow in the community increases again, then that may affect our state, given that we are in a stable but not on a declining trend yet. Now, I'd like to talk about how we are going to strengthen support for the elderly. Last week, we said that one of our focuses should be to reduce our death toll, reduce infections, and reduce serious cases. Now, we've got major progress. The first is the availability of drugs. Well, at the suggestion of the Hong Kong U team, medication is the most effective way. So on Monday, the second batch of effective oral agent, that is Pfizer's Paxlovid, arrived and is being used widely in Hong Kong. And Molnupiravir, manufactured by MSD, has already been used before Monday, and have made it very clear to the hospital authority that is most important to save lives, and therefore we don't have to be frugal in the use of the drugs, and we have contacted the most senior level of the two drug manufacturers, and so we can administer the drugs to lower the need for hospitalization. And as said yesterday, the HA has already prescribed the drugs to over 34,000 at elderly care homes, outpatient clinics, and inpatient, and also A&E department, and also people who sought help at designated clinics, especially the elderly. I'm pleased to announce that according to doctors, the drugs are very effective. Starting from today, CGET, and that is the Community Geriatric Evaluation Team, will support confirmed cases in elderly care homes. Based on clinical guidelines, doctors will administer such drugs if they consider appropriate. And also the Patient Support Call Center of Hospital Authority will also take the initiative to contact people being isolated at home with risks. If need be, they can be arranged to attend designated clinics to get the drugs. Now, we had Zoom meeting with the private hospitals last week, and they are very willing to provide beds, and they're willing to provide consultation for confirmed COVID cases at their outpatient department. We will provide these two types of drugs to private hospitals because they're not able to procure them themselves because the drugs are not yet registered, and so the drugs will have to come from HA's inventory. In elderly isolation centers and holding centers run by SWD, the medical staff will also administer the drugs to elderly patients. The fifth enhanced measure is to set up as many holding centers and community isolation facilities for our elderly as soon as possible. We already got 2 CIF and holding centers at 2 indoor games halls. The third at Harbour Road will be commissioned today, and then by the 21st of March, we will also commission the CIF at Kaita Cruise Terminal, which offers 1,200 places, and 6 more indoor games halls will gradually be converted to serve as CIF. Another location is at Hong Shui Kiu to further support the elderly that require isolation and to focus our treatment facilities. Hong Shui Kiu is a community isolation facility built with the support of the central government. Is actually a cabin hospital. We will have a 200 places CIF come holding center for elderly persons that require isolation and treatment to lessen the burden on hospital authority. These elders are milder cases with milder symptoms, and they need isolation and medical support. As I said, when the hardware is available, the greatest bottleneck is personnel. So the government has adopted a multi-pronged approach to hire carers, including those from the mainland and from Hong Kong. 180 carers have arrived from the mainland, and after training, they will start to serve at holding centers. For local recruitment, judging from the number of applicants, we see that the response is very encouraging. But they need to be interviewed by SWD first to see how many will actually join the team. The fourth is to provide more support to RCHGs in terms of provision of supplies and hotel facilities for closed-loop management of their staff. We understand that over 100 staff from over 100 elderly care homes are willing to adopt this closed-loop management arrangement. So starting from the 9th, they have moved into these hospitals. Another new measure is reverse isolation, and that is if there is an outbreak in care home, the appropriate approach is to move the non-affected elderly persons from away. The RCHGs. There are 2 licensed newly built RCHGs that can provide 200 places for residents, for healthy residents from RCHGs with cases of outbreak. They can then be subject to reverse isolation to protect them from any infection. Of course, the most effective way is vaccination. Among the eligible group, that is those over we have already achieved 90% with the first dose, but those over 70 or 70 to 79, 80%, and those over 80, 55%, we have to raise the vaccination rate for these groups to 90% as soon as possible. The expert groups have agreed that the interval for the second and the third phase can be shortened. Apart from the elderly, children as a group, we want to boost the vaccination rate for those between 3 and 11. 55% of them have been vaccinated. And if children want to resume classes after the Easter holidays, they must be vaccinated. For secondary students who have achieved to 90 or over 90% vaccination rate, and if primary students cannot catch up, then that may affect the chance of resumption of face-to-face classes. I took a little bit longer time in my report, so I can reserve more time for questions. But I'll first give the floor to Dr. Edward Choi, Controller of CHP, to report on the RAT declaration work.
頭先我哋有張幻燈片特別講到係話個 RAT。
From one of the slides, we talked about the cases reported through the RAT declaration system since it was launched. For cases from February the 26th to March the 5th, those would be reported between the 7th to 14th of March. By March the 10th, we saw that people who tested positive would declare their cases almost immediately, and they would receive an SMS message, and then they would be able to upload their Hong Kong identity card copy and a photo of the RAT results. And since March the 10th, the figures we compiled could accurately reflect the daily figures. Like the CE said, we received some 184,000 reported cases with the distribution as shown on the chart. These figures were very useful to us because we were able to see the number of cases reported every day. We have 2 main systems, the RAT system and PCR system. We saw a rising trend in the pandemic from the 21st to 22nd of February, and we saw a peak on around 2nd to 3rd of March, and we saw 76 to 77,000 cases, and after March the 4th, we saw a declining trend. In the past 7 days, the number of reported RAT and PCR cases was at around 30,000 per day. We saw some fluctuations. Sometimes we had less, sometimes we had more than 30,000. Even though we have passed the peak of 70,000 cases per day, the virus remains active in the community since we still have almost 30,000 cases per day. After receiving the reports, we would carry out random investigation for those who declared positive RAT results. We would deploy contractors to visit their homes, and the they would be requested to provide nasal samples, and we saw that in about 30 cases the results were negative, and we would further investigate these cases to see why, despite the positive RAT results, the random samples came back negative. Some people misread the RAT results. They thought the indeterminate or pending results were positive. We now proceed to questions. Please raise your hand and identify your organization before you speak. As usual, since we have a large number of media outlets, please restrict yourself to no more than 2 questions, and you will not be able to ask follow-up questions. The gentleman at the back, please. I'm from RTHK. Mrs. Lam, 2 days ago, you said you had no plans to tighten the social distancing measures, but there were news today that the dining in service will be restricted to 1 patron per table. For those who are unvaccinated, they could not secure proof for vaccine pass. So how are you going to deal with them? As you said, more than 180,000 people tested positive through the RAT system. Some people were concerned that if they declare their positive results, they would be sent to the makeshift hospitals. That's why they did not declare their cases. So would 180,000 be an underestimation? Some people indicated that they received the test kits after they recovered, and when they were sick, they had to ask their family members to purchase supplies and food for them. Since many people have been infected and recovered, do we still need so many isolation facilities at Kai-Tak? Could they be converted into treatment facilities for those in serious conditions? Chief Executive. In this wave of the epidemic, we have installed the most stringent social distancing measures, and we have no current plans to further tighten these measures. We saw that the public might have let their guards down. I just showed you the commuting figures based on Octopus records. We saw a slight rise in the number of commuters. We call for the public to refrain from going out unless necessary, and employers should allow their employees to work from home. As for what happens in beaches, the measure is nothing new. So that the management of beaches falls under the LCSD. The service at swimming beaches have been suspended for a long time. Many people nowadays visit the beaches since the weather is hot, and sometimes they had no mask on. And so the LCSD might have to reinforce the management of these beaches, for example, by sealing off these beaches, and this is a move we once put in place previously. We do not want to see people flock to beaches, and our goal is to safeguard the entire system. We want to reduce the flow of people and minimize gatherings for the benefit of public health. For those who were unvaccinated but have since recovered from COVID, in terms of the vaccine pass arrangements, I would defer to the Secretary or the Controller. For the 180,000 odd cases who were infected after February the 26th, we did not conduct any follow-up actions. You said that those who tested positive through RAT were wary of being sent to isolation facilities. That was not our objective. In our press release on February the 25th, we explained the objective of the exercise, which was to give us a better grasp of the pandemic and to allow those who were infected to prove that they had recovered from COVID-19. Sometimes the proof was useful, for instance, to secure exemptions from vaccination, and sometimes proof would be needed by the employers. As to whether we still need so many community isolation facilities, we are constantly monitoring the situation. Given the enormous number of patients, not all patients who tested positive could be sent to community isolation facilities. And we saw that many people follow the rules by staying at home and self-isolating till they recover. And if necessary, they could call the hotline and seek medical attention at designated clinics. So as to whether there will be adjustments to our community isolation facilities going forward, this is something that will be considered by the SAR government.
Some tested positive patients and being isolated at home may not be able to receive the antiepidemic kits, and also who are unable to contact the hotline. We apologize, but we are now catching up. Yesterday, we distributed over 60,000 antiepidemic kits, and through the Department of Health, or starting from the midnight of the night before yesterday, they were approached by the Department of Health, and they numbered over 60,000, and they were all distributed. They were all provided with anti-epidemic kits. So we will do it more quickly, and we will enrich the contents of the anti-epidemic kits. For instance, some people could not buy paracetamol, and now it's included in the kit, and some elderly persons would like to know their blood oxygen level, and now an oximeter is already included in the kit. When it comes to converting CIFs for treating serious cases, that is not possible. If you have visited the CIF at Qingyi or Santin, you will see that they are like holiday camps for isolation of mild cases. For instance, there are 3 in a room. It's impossible to treat serious cases that would affect the provision of medical services. However, in all CIFs, there is a medical post, but then the layout and the construction of these CIF is not like a big medical ward to help serious cases. Now, apart from CIFs, we have the Asia World Expo, Community Treatment Center run by the Hospital Authority, and also the place run by SWD, originally meant for elderly quarantine, but now used for quarantine isolation. They are more appropriate for treating serious cases, but then we didn't have enough personnel, and we're grateful to the central authorities for helping out. 76 arrived earlier, and this afternoon a few hundreds would arrive. I'm going to welcome them at our border crossing point personally. So with treatment facilities and manpower, I'm sure we can boost our capacity. to lower the risk of our elderly patients turning into serious cases. SFH, please talk about the relationship between the vaccine pass and also those who have recovered. Since the launching of the vaccine pass and also the Joint Scientific Committee have made recommendations on the use of different types of vaccines and also the time intervals between the first and second and third doses, and also the overall conditions of our recovered patients. The Joint Scientific Committee have got their considerations and also professional recommendations for different scenarios. Of course, if a person hasn't been vaccinated at all but has recovered from COVID, what documentation should he provide? At this stage, we have a computer platform, and staff at premises covered by vaccine pass will deal with that. We have administrative measures to handle these cases. And the different arrangement for people under different scenarios are dealt with by the Joint Scientific Committee. Of course, will be lenient, and if the computer system is not yet up and running, then paper-based documentation is also acceptable. This lady in the back.
Reporter with Bloomberg News. The first question is about with the HKU estimating more than half of the citizens might soon to be infected, and Mrs. Lam just said that the daily cases like plateaued. And are you still trying to get cases back to zero? And if so, whether you will reinstate the measures that like contact tracing or compulsory isolation for all cases, if like the level becomes down to the manageable level, and whether Hong Kong will live with the virus. And the second questions will be on the mainland. Shenzhen and Shanghai has saw like surge from import cases from Hong Kong, and whether Beijing has ever expressed concern whether people from Hong Kong would be seeding outbreaks to the mainland, and whether you anticipate that the further restriction for people crossing the border from either going to mainland side or people from mainland coming to Hong Kong. Thank you.
Thank you for the two questions. The first question is, I am not in a position to comment on any estimates or modeling done by our academic community. I think they are all doing it in their respective scientific way based on assumptions and the data that they have collated. But over the last 2 years and so, we have been working very closely with the various research groups. Some of the graphs that I have shown you just now were also taken from the study by the Hong Kong University Medical Faculty. But judging from the high numbers that we have seen, it will not be a surprise that there are still a lot of silent transmissions in society. And if people now become a bit relaxed and they go out more often and they have gatherings and so on, then this transmission will continue because Omicron is very, very highly transmissible. And that's why I repeatedly try to convey the message this morning that this is not the time for relaxation. This is not the time for being complacent that Hong Kong epidemic situation is going to improve significantly in the short term. Now, of course, I think in every society we should strive to do our best in combating a public health crisis. Hong Kong has been trying her best since January 2020 to suppress the spread of the COVID-19 virus in Hong Kong, to prevent critical illness, and of course, as far as possible, to avoid deaths. At any point in time, we need to revise, review, and adjust our policy measures. In the current fifth round, yes, we have made far more adjustments to our measures than the previous 4 rounds because the numbers were simply not manageable if we continue to do what we have been doing in the last 2 years, like doing contact tracing of every case and trying to identify the close contact and the close contact of the close contact in every case, and putting every of such close contact or confirmed case in an institution. That is simply unrealistic. So we have to adjust our policies by going for this tiered level of isolation and treatment. And of course, we will critically review our experience in this round and decide on how Hong Kong should tackle a future wave of COVID-19 or any other virus in order to achieve the best results. And let me make it clear that the best results, as I said at the very beginning, of fighting the epidemic are public health results, economic results, because I can't see the economy being torn into pieces by just going for public health measures. And third is the people's acceptance and tolerance. So we will continue to be guided by those important principles in devising the best public health strategy for Hong Kong. Now, the second question is about the border. And I have to say that the Central People's Government has been extremely understanding and supportive of Hong Kong. With the clusters now being seen very close to Hong Kong, that is in our neighboring city of Shenzhen. One would expect that Shenzhen could easily close the border, that no Hong Kong passengers could cross the border into Shenzhen in order to cut the transmission. But Shenzhen has not taken this act, and I believe the Central People's Government also does not want to see this happen. So we still have a certain degree of people flow from Hong Kong into Shenzhen, but where the public health considerations dictate, that is, Shenzhen wants to impose more stringent pre-arrival tests of PCR and 24 hours instead of 48 hours, then of course it's a very legitimate response of the city government, and the Hong Kong SL government will fully cooperate and support Shenzhen in taking those legitimate measures. Similarly, for the flow of cargo, the Central People's Government, the Guangdong government, and the Shenzhen government officials have all told me and assured me that they would try very hard to ensure the smooth arrival of cargo, especially fresh produce and vegetables that would support the people of Hong Kong. But we need to find alternative measures. So instead of just relying on 8,000 cross-border truck drivers transporting the goods on a daily basis, we now have cargo coming in by sea. We now have cargo coming in by train. So this is to illustrate to you that this very strong support from my mainland counterparts, despite the difficulties or the emergency situation that they are now facing. So we will continue to cooperate fully with the mainland authorities to take the necessary measures to protect the safety and the health of people on both sides, because we belong to one country and we are compatriots, and we would love to see both sides of the border coming out of this epidemic as soon as possible. Thank you.
好，我哋問第三位記者嘅兩條問題。最前白色衫嗰個男記者。
Next question, please. Mr. Sam, this is from the Hong Kong Economic Journal. I have 2 questions. The former Secretary for Commerce and Economic Development, Geoffrey Ma, criticized the government of mishaps in policy, and according to a latest poll, your rating has hit the lowest in the last 2 years. So, do you have any plans to reinstate public confidence in the government's anti-epidemic work? You said that the pandemic has hit a plateau. Would this be a reason to further postpone the chief executive election? The nomination period was postponed, and there are only 2 weeks left. If the election is to be further postponed, what would be your considerations, and are you going to set a deadline for making a decision? In the fifth wave of the epidemic, we can see how severe the pandemic was based on the caseload and deaths. I understand criticisms people may have of the SAR government, and as the head of the SAR government, I do accept criticisms, so I will continue to accept criticisms in a humble manner, and I would urge my team to do their very best in fighting the pandemic. This is my only priority right now. And like we explained on February the 18th, it was a very difficult decision. I have participated in an election, and I had to form my cabinet in the aftermath of the election. If we further postpone the election, then the chief executive-elect would have less time to complete the work. But legally speaking, there is scope to further postpone the election by invoking the emergency regulations ordinance. Hong Kong has electoral legislation, and according to the basic law, the term of the chief executive is 5 years. So any further postponement is beyond the ambit of the SAR government, and any further postponement would be decided by the central government, and the Hong Kong SAR must have a head in place. So I could only say that further postponing the election would be a difficult decision, and myself as chief executive would discuss this further with the central government. I submitted a report to the central government, and the central government agreed to a postponement, so I believe similar considerations will be in play for any further extension. The next question, please. Good morning. I'm from CCTV, and with the support of the central government, a lot of supplies arrived in Hong Kong, but many people are yet to secure sufficient medical supplies and support. Chief Executive, how can the SAR government tackle this issue of providing the last mile? And can you give us an update on the support offered by the mainland delegation? And in recent days, we saw large fluctuations in Hong Kong stock market, and the Hang Seng Index fluctuated by more than 1,000 points. How can we reinstate people's confidence in the stock market? Today, the entire world is facing various instabilities, including conflicts and a war-like situation. Hong Kong, as an international financial center, would see no exception. But the key is to maintain financial stability and market oversight, and these elements have not been affected by fluctuations in the Hong Kong stock market. we have remained financially stable. The Hong Kong dollar has remained stable through the Security and Futures Ordinance and Hong Kong Exchange. Our markets have remained stable. I would not go into a detailed analysis. I believe inquiries have been made to the Financial Secretary's office, and I believe the FS might be able to offer a more professional judgment. In terms of the support offered by the central government, it has been comprehensive. Medical supplies have arrived in Hong Kong from the central authorities and through different departments, and the supplies are gradually arriving, but some have yet to arrive since logistics on the mainland have been affected, and these include RAT kits. We have ordered hundreds of millions of sets, and only about 50 million sets arrived. For those who are deemed to be high risk or those from certain sectors, we have to consume 2 million test kits per day. These include residential care homes for the elderly, discipline services offices. We must maintain a stable supply of RAT kits to these individuals every day. And we would ensure that the test kits offered by the central government would end up in the hands of the public, and we have distributed 8 million sets. These have been distributed on the district level by the Home Affairs Department, including those who live in areas with high sewage viral loads, and through the Hong Kong link connection, supplies have been distributed for proprietary Chinese medicine. They have all been distributed. About 450,000 sets have been donated by the mainland government, and they have been distributed through the Hong Kong link connection, the HA's designated clinic, and Chinese medicine clinics. So we did not experience any issues with the last mile. Every night, we would issue a daily press release on the amounts of supplies distributed, but some people might not realize that the government itself has a demand on supplies, including the N95 respirators, so we cannot distribute all our supplies because we must ensure that there is a stable supply for staff at RCHEs, discipline service officers, etc. But nonetheless, we are planning for larger scale distribution of supplies for those who are quarantining at home. A home kit would be distributed, including an oximeter, thermometer, etc. We are planning to distribute anti-epidemic kits in the community for those who are yet to test positive. So we must mobilize NGOs to help with the distribution. Due to the restrictions in Shenzhen, logistics have been affected in recent days, so we will continue to work hard on this front.
Secondly, the medical teams. The first batch of 16 vanguards, and they have been here for a few days. They observed the operation of Asia World Expo. They have come up with a plan, and then 75 members have arrived already, and the few hundreds arriving this afternoon will also come on board. And as regards the collaboration, because Professor Chen have met them, so perhaps she can elaborate on this. Thank you, CE. The mainland medical teams are here to help the HA to treat COVID patients. We're now in a dire situation, so we are most grateful to the mainland for their support. The first team of 16 have been here for close to a week, and they have been discussing with the HA on a collaborative model on how to cooperate, and they have visited the AWE community treatment facility to see patients. They also have to understand our medical procedures, our nursing and care mode, and also the clinical conditions. The 75 who have just arrived are discussing with the hospital authority on their future work, and they have divided into 2 groups to go into the red area of AWE to understand the treatment model and HA's medical procedures at AWE. Yesterday, there was a briefing on infection control and patient treatment. As said by the chief executive, a few hundreds will arrive today. They'll continue to liaise very closely with the hospital authority to decide on the work arrangement. All right, the last question for today. The lady in the front. I'm from Now TV. Chief Executive, it was just mentioned that primary students who are not vaccinated may not be able to attend face-to-face classes. Does that mean that they are not allowed to attend half-day school or full-day school, or cannot attend any face-to-face classes at all? And as for social distancing measures, the chief executive said just now that we must not be complacent. Does that mean that existing measures will stay until the 20th of April at least? Apart from sealing off of beaches, will there be stricter measures? Now, I'd like to know whether the sealing off of beaches is on the advice of the mainland medical team. We were told that the mainland medical teams have arrived. Can you tell us how the frontline operation would be? Because local healthcare personnel are saying that should there be any medical incident, what is the mechanism for complaints and handling, and how can the community and patients be confident with the overall collaboration? And as for supplies from the mainland, there is a shortage of coffins. Can you comment on this as well? Professor Chen will comment on how the mainland medical staff can assist in treating patients here. I hope the media can agree that we should be first and foremost grateful to mainland medical staff who have set aside their work in the mainland, because they all serve in medical institutions in the mainland. They're for their own patients, and they have to leave their families and come to Hong Kong to assist Hong Kong to treat our patients. I hope we can view the deployment of their duties in Hong Kong on this premises. Now, as for schools, I already talked about a 2-3 month plan in February. I said that schools would not want to have online classes indefinitely. they have already adjusted their school calendar for 2020-21. They advanced their summer vacation. The target is for students to return to school for classes on the 20th of April. That is still our objective. And our primary students will return to school campuses first because starting from the 20th of April, secondary school premises will be used for DSE examination. So this is our target. After the Easter holidays, students can return to school for classes, and then we can start DSE examinations on the 22nd of April. I appeal to school children aged 3 to 11 to be vaccinated, because after vaccination, there will be more room for schools to arrange lessons and extracurricular activities. Of course, we won't say that no vaccination means that you can't go to school, because children have the right to education. But then schools can make arrangements on class lessons and also extracurricular activities based on the rate of vaccination. But of course, all parents want to protect their children. The vaccination rate in this group is just 55%. I think we should make use of this time to boost the rate to 90% among the secondary school children. I think this is a good thing to do. I encourage the parents to take their children for vaccination as soon as possible. We have made special arrangements and vaccination centers for children. I just saw a letter from a primary school principal to the CSB thanking us for the special arrangement on-site vaccination, and very quickly over 400 students were vaccinated. I understand that only 2 questions were allowed, but since you've asked a third one, I'll try to address that question. Cross-border logistics have been affected, and that's why we have created new channels. The funeral service sector, through the FEHD under the Food and Health Bureau, have been in very close liaison. The department has been in touch with the sector to ascertain the difficulties. I think this is just the way the department dealt with the slaughtering sector. We are trying very hard to coordinate, and we are discussing with the mainland what measures can be taken. From the Bureau, I heard from the Bureau last night that they are making arrangement for coffins to be delivered by sea. There are 3 suppliers, and at least 2 batches of coffins will arrive by sea. So we will keep addressing problems as they arise. Since you asked about the arrangement for the deceased, now, within such a short period of time, we have so many deaths, and that would affect the logistics of funeral matters. Myself and Sophia Chen have tried very hard to address their concerns, such as the time for issue of death certificates and for bodies directly sent to a public mortuaries without a death certificate issued by a doctor. We will try to make arrangement for family members to receive the bodies for funeral arrangement. Usually a coroner's inquest is required, but because of the COVID situation, we'll make arrangements for family members to claim bodies of the deceased, to arrange for cremation as soon as possible. And our crematoriums are working day and night, and they are already close to their capacity. So Whenever there are issues, as soon as we learn about them, we'll do our utmost to help people affected and also the community to tackle them.
都必須從
I stress that Hong Kong is facing a severe situation, and we thank the mainland for sending a medical support team to Hong Kong. We believe the medical support team can reinforce Hong Kong's capacity to receive and treat these patients given the severity of the pandemic. Well, the mainland medical support team is vastly experienced in treating COVID patients on the mainland, and together with their expertise and experience, they can provide timely support and achieve synergy with our team at the hospital authority. The HA has maintained communication with the mainland medical support team. They first visited the Asia World Expo community treatment facility and look at the infection control and treatment procedures. After the support team arrived in Hong Kong, they would first support the Asia World Expo community treatment facility. The HA's medical staff would work with them in different ways, including the treatment on patients, interfacing with the local medical crew. We are looking to reduce the number of admissions, number of transmissions, number of cases, and serious complications. So we would work hand in hand to realize these goals. And in terms of responsibility, the HA has engaged the mainland medical support team as honorary employees, so the current insurance provisions on patients would apply. The mainland medical support team would work with the HA staff based on the established procedures and to attend to patients jointly at the Asia World Expo facility. When the mainland support team implements some medical procedures, their role would be identical to HA staff, and the HA would assume ultimate responsibility in this regard. This is the end of the press conference. See you at 11 a.m. tomorrow.